Today, the CDC is responding to the idea of a nuclear detonation. They're holding a safety session on January 16th. In the meantime, though, we're checking with local officials to get their input and find out if an emergency plan is in place here. CBS 42 News reporter Hillary Simon went to the Jefferson County Department of Health. And Hillary, they told you that they have groups in charge of radiation exposure specifically.
Sherry, that's right. I talked to Julie Cobb, who works under the Emergency Preparedness and Response Program at the Department of Health, and she says they have local radiological trained teams who have researched these kind of things. But if something like a nuclear exposure were to happen, it would depend on how much was exposed and what it exactly was.
The idea of a nuclear war happening is concerning to some people.
I haven't seen any kind of prevention or something to do if that were to happen. I don't know. I think there needs to be more of a civilian awareness of that.
Pretty unlikely, or at least I'm naively hoping that it's very unlikely, because I'm not sure that there's very much that I as an individual, or really even we as a system, can do to prepare for something like that.
But Julie Cobb, who works at the Jefferson County Department of Health, says they do have things in place for any kind of disaster.
Whether it would be a hurricane or a nuclear detonation, we would just like everyone to know that we do work locally with all of the responding agencies through the Healthcare Coalition, through the Jefferson County Emergency Management Agency, and we do have those plans in place.
Cobb recalled back in 2012 when a local middle school was exposed to mercury and students had to be tested. In the situation of radiation exposure, they could do something similar. It's called a POD, point of dispensing. It's a designated area where everyone can meet at one spot and get medication for free. But Cobb said it really depends on the situation.
If we had the assets here locally where we could handle this, then we would just take care of it locally with the local hospitals. If it did exceed our local capabilities, we would go to the state to request additional assets. And if it went outside of the state's capabilities, then we would have to do a federal request.
She wants everyone to know that if this were to happen, there are plans in place.
We don't want people to be, feel threatened by this. We don't want them to be alarmed. We want them to know that we do take these types of things seriously, that we do work together.
The CDC says sheltering for 24 hours is one way that can maybe save a life and reduce the exposure of radiation. In the newsroom, Hillary Simon, CBS 42 News, local coverage you can count on.
Hillary, thank